Welcome. Today we are looking at hypoglycemia, what it means, and how to manage it. Hypoglycemia is a condition in which your blood sugar level or glucose level is lower than the standard range. So in a nutshell, hypoglycemia is low blood sugar level. In Nigeria as we speak, there are more than 100,000 cases per year of people having hypoglycemia. There are different levels of hypoglycemia. There are the mild to moderate glycemia, then there's this severe glycemia. For many people, 70 milligram per deciliter or 3.5 millimole per liter or below is an alert sign for hypoglycemia. Treatment usually involves quickly getting the blood sugar level back to within the standard range, either with a high sugar food or drink or with medication. Sometimes, when it's in severe cases, you need a long-term treatment which involves identifying and treating the root cause. So what are the causes of hypoglycemia? Hypoglycemia occurs when your blood sugar level falls too low for bodily functions to continue. Hypoglycemia is usually a side effect of medications used to treat diabetes. Some of the symptoms of hypoglycemia are anxiety, confusion, dizziness, hunger, irritability, nervousness, shaking, sweating, headache, slurred speech, loss of coordination, and faster heart rate. Let's look at blood sugar regulation. When you eat, your body breaks down food into glucose. Remember that glucose is the main energy source for the body. So this glucose enters the cells with the help of insulin, a hormone produced by the pancreas. Insulin allows the glucose to enter the cells and provide the fuel that our cells need. Extra glucose is stored in the liver and muscle in the form of glycogen. So when you haven't eaten for several hours and your blood sugar level drops, you will stop producing insulin. Another hormone from your pancreas called glucagon signals your liver to break down the stored glycogen and release glucose into your bloodstream. This helps your blood sugar to be maintained within a standard range until you eat again. Also, your body has the ability to make glucose. This process occurs mainly in your liver, but also in the kidney. With prolonged fasting, the body can break down fat stored and use the product of fast breakdown as an alternative source of energy. Untreated hypoglycemia can lead to seizure, coma, and death. Hypoglycemia can also cause dizziness, weakness, falls, injuries, motor accidents, and greater risk of dementia. How common is hypoglycemia? Hypoglycemia is common in people with diabetes, especially people who take insulin to manage the condition. One study found 4 in 5 people with type 1 diabetes and nearly half of all the people with type 2 diabetes who take insulin reported a low blood sugar episode at least once over a 4-week period. Severe hypoglycemia is life-threatening. It needs immediate medical treatment. Severe and prolonged hypoglycemia can lead to multiple organ failure, cardiac arrest, permanent brain damage, coma, and death. What causes hypoglycemia for people with diabetes? Hypoglycemia happens when your blood sugar drops below a healthy range. Several factors can contribute to this for people with diabetes. 1. Taking too much insulin or taking the wrong insulin or injecting into your muscle instead of your fat muscles. 2. Not timing insulin and carb intake correctly. For example, waiting too long to eat a meal after taking insulin for the meal. Taking too much or too high of a dose of oral diabetes medication. 4. Being more active than usual. 5. Drinking alcohol without eating. 6. Eating meals later than usual or skipping a meal. 7. Not balancing meals by including fats, protein, and fiber. How is hypoglycemia diagnosed? It is diagnosed by checking your blood sugar with a glucometer. If for people without diabetes and you're experiencing recurring episodes of hypoglycemia, eating frequent small meals throughout the day is a stopgap measure to help prevent blood sugar levels from getting too low. So if you have diabetes, follow the diabetes management plan that have been given by your healthcare provider. Take your medications, change your eating plan, make a lifestyle modification. It is really, really necessary. Add exercise to your routine. Learn the signs and symptoms of hypoglycemia. For some people, the use of continuous glucose monitor, CGM, is a good option. A CGM has a tiny wire that is inserted under the skin that can send blood glucose reading to a receiver. And if the blood glucose levels are dropping too low, some sort of alert is sent to alert you to be able to take something that will help boost the sugar level. Always have a fast-acting carbohydrate with you, such as a juice box, hard-boiled candy, glucose tablets. This will help in case of episodes of mild to moderate hypoglycemia. So like we have said before, take all your medications exactly as prescribed. Follow your diabetics meal plan, both the food and exercise part. Use your continuous glucose monitor. Check your blood sugar regularly, including before and after meals, before and after exercise, and before bed. Always have snacks available. Learn your personal warning signs for a low blood sugar and learn to monitor your blood sugar regularly. The management of hypoglycemia. You treat mild to moderate hypoglycemia by eating or drinking sugar drinks. The American Diabetics Association recommends the 15-15 rule to treat an episode of mild to moderate hypoglycemia. Eat or drink 15 grams of fast-acting carbs to raise your blood sugar. After 15 minutes, check your blood sugar. If it is still below 70 milligrams per deciliter, have another 15 grams of fast-acting carbohydrates. Repeat until your blood sugar level is at least 70 milligrams per deciliter. If you are somebody that is living with diabetes, it is very important that you regularly monitor your blood sugar level. This will help you to either check whether it's too high or too low and to take the appropriate action. And secondly, please adhere to your diabetic meal plan. The reason why the meal plan is given to you is so that you will eat what will help you manage your blood sugar very well. You don't go binge eating. You don't go eating what you are not supposed to eat. You eat healthy meals. Eat in small quantities. Eat and snack along. Stay away from sweetened beverages. Eat lots and lots of fiber. Exercise at least 150 minutes per week. Sleep well. Learn to manage your stress well. If you do all these things and you are consistent over time, you'll be able to consistently monitor, consistently manage your blood sugar to live a normal life like every other person. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos as they drop.